Time to connect to Congress, and this is a segment where we invite Washington lawmakers who represent us here in the San Joaquin Valley. This morning, we are talking with Democratic Representative for the state's 21st Congressional District, Jim Costa, who is currently back in the Valley. Good morning, Congressman Costa. Thank you so much for being with us.
Good morning, Liz. As I always say, it's great to be on Great Day, and it's even better to be home.
I'm sure it is. It's just the heat. That's the only thing. Congress is back home for the August district work period. Lawmakers, though, are still negotiating a federal spending bill in the Senate. What would you say are the biggest issues that you're keeping an eye on, and what impact could this legislation have on families here in the central San Joaquin Valley?
Well, the concurrent resolution that the Senate worked out, I guess, this week on a bipartisan basis will extend and avoid government shutdown until December 11th. It has bipartisan support, and I'm hopeful that when we get back in September, we'll be able to act on that, try to take care of some of the other pressing issues that involve affordability, and then after the elections, get back and pass a budget. But let me say that this week is Affordable Care Week, not only here in our San Joaquin Valley, but across the country. Affordable health care is key to every American. You've heard me say, my mom once told me, if you don't have health, you don't have anything. There's over 1.8 million people in the San Joaquin Valley that are being impacted by these Medicaid cuts. In my district, it's 466,000 people. That's over half my congressional district. And it's believed that over 200,000 will lose their health care insurance. We've got to bring this to the attention. We're on a health care cliff that is right in front of us. If we don't do efforts to extend Medicaid to the health care facilities, our hospitals, our clinics that are the important link to ensuring that people in this valley and across the country have good health care. And let me also say that, to add insult to injury, the administration is currently withholding $879 million of funding to California. And that's not right. So it's very important, and I will continue to fight to ensure that we have adequate funding for Medicaid, for our health care hospitals, and for our clinics. It's absolutely essential.
Congressman Costa, do we know, I know you mentioned the withholding of funds as well as some cuts. Do we know how that is already, if at all, affecting our hospitals here in the Central Valley?
Well, they're trying to take measures to reduce their expenditures. We're going to have a meeting, and we've been doing this about every 4 months with our hospitals, Community Medical Center, the largest hospital in California, Valley Children's, one of only 5 trauma and burn center units, which 76% of those little ones are reliant upon Medicaid for their health care provisions. And all the clinics that have been expanded to provide health care in our rural areas, they're all impacted. We're going to meet with them again this week to look at how they're trying to figure out an ability to move forward and to keep their doors open and to keep health care available to all the citizens of our valley.
I know that we've been talking, and so much of the focus has been on people losing their coverage. But again, you also have to look at the structures that are in place right now and the systems that are in place to provide that coverage, which, again, they eventually will need help to pay for. Being that you're here for the next couple of weeks back in the district meeting with constituents, and you've been here maybe for a couple of days already, what are you hearing the most from people in your district, and what would you say will be your top priorities while you're here?
Overwhelmingly, it's affordability, the cost of living. People going to the grocery store every week trying to figure out how they can put food on their family's dinner table. The cost of gas for work, going to work, and for other purposes. Diesel fuel for our farmers that rely upon that, and the cost of fertilizer that has increased as a result of this war in Iran. And the tariff issue. I mean, 85% of our potash for fertilizer for this valley comes from Canada. We have an agreement with Canada and Mexico that includes 40% of our trade. I mean, these are our neighbors that, we've had wonderful relationships with historically, and we should not be at a tariff war with either country. It makes no sense.
Congressman Jim Costa, that is up for a time. I'm just being told in my ear. Thank you so much for joining us here on Great Day. Great Day. We'll be right back.
Stay cool.